to carry this pregnancy to completion. Most women, by the time they come, you discover they have hypertension. By the time you now tell them after delivery, come back, you will not see them again until they are pregnant again. Look at the irony. In the first 3 months, the first 5 months of pregnancy, there is always a reduction in blood pressure. So somebody whose blood pressure has been consistently 140/90, for example, is hypertension. Now, this person has carried this blood pressure of 140/90 over time. By the time she takes in, she will come to the hospital. Ime sure BP mgbe ahụ ọ bịara ọfụrụ, BP ya nwere ike be dịka 120 or 130, and it will be deceptively low, because normally first trimester of pregnancy is associated with reduction in blood pressure. That's why somebody whose blood pressure is naturally 120/80, ordinarily she might come here and we are getting 90/60. And they will tell you, doctor, it's anyway BP, so you might not low BP. That BP is actually normal. I don't know if you understand. It's actually the pregnancy that brought it down by 20 millimeter mercury. So if that person was naturally pulling a blood pressure of 140/90, which is hypertension, grade 1 hypertension, and by the time they are coming to now register, you see a BP of 120/80. 120/80 to a layman is what? Normal. Okay? But this normal pregnancy that brought it down to normal. By the time the pregnancy reaches 5 months to 6 months, the BP will now go up to what it used to be before the person took in, and he will now start seeing 140. The irony of it is that that person starts thinking now it is only body make on a way BP. But the truth is that it is only body make on a check. There are some people that will come to the hospital. You see, do you have high blood pressure? She will say no, that this blood pressure usually rise only when he is sick. No, or the truth is that that person has been having high blood pressure, but he or she only remembers to go to check only when he is sick. And it is that time that he will go and check. They will tell you he is high. Some of them, you will tell them you have BP, write some drugs. They will say no, that it is when they start having sign. Let's get the record straight. BP has no sign, it has no symptom. For BP to give you sign, it means that it has started destroying something. That is why it is called a silent killer. Because you will not have any symptom. But somebody will tell you, issue now where that BP the high, no why issue. It's not true. When somebody have normal hypertension of 140, 150, this is hypertension. This can cause both chronic complication and acute complication. Usually it has no symptom. The only thing it has is what? Sign. And that sign is that you go and check the blood pressure, it is high. So it's not whenever you come around and there was a trace of hypertension in pregnancy, after delivery you are supposed to be followed up for at least 3 months, and we are sure that there is a total resolution of the problem. But some women will carry some threat until when the whole thing finally break down, they will now accuse someone else. Apart from that, there are some other conditions, but that one usually manifests with frequent miscarriage. There's what you call antiphospholipid syndrome. Antiphospholipid syndrome usually will happen to women by the time they take in, usually 3-4 months, 2 months, they have frequent miscarriage. It's an autoimmune disease. But instead of coming back to say what is causing this, most women, when they have miscarriage, after that evacuation, you will not see them again until they come again for another evacuation. And that time they have that miscarriage, instead of coming back to say, at that time you are doing the evacuation, you cannot find out the cause of the miscarriage. But after that, we can now bring her back. Check here antibody. Is there anchor? What is the full blood count? KSR is what? Is there feature of chronic inflammation? Then if there is, what do we do? Which of these conditions is responsible? Sometimes in trying to prevent her from having more miscarriage, you will make an accurate diagnosis of what is causing that miscarriage. And by the time you have found out what is causing that miscarriage, you will now start following up. What are the other things this medical condition can cause apart from miscarriage? And one of the things they can cause apart from miscarriage is what? Kidney problem. So by the time you start addressing it, you are preventing future miscarriage and also preventing the development of chronic kidney disease in the future. But most of them, we just start accusing one innocent woman. This person might be having antiphospholipid syndrome. If we give prednisolone or what, we arrest this situation. If we give even chloroquine, the situation can be arrested. Otumba. Because you will not see them again until they are sick. And I keep saying, hospital has changed. The name of hospital has changed. What is the Igbo name of hospital? Unogu. That is the problem. The name is no longer Unogu. It changed the name. The most recent name of hospital in Igbo, everybody believes that by the time you come to the hospital, you must go home with drug. So no matter what you do, that's why people keep on trying to change the norm. So the name is what now? So no, anyhow you get the ahuike, it doesn't matter. Then another thing that usually causes this kidney disease is too much taking of drugs that are not necessary. An average Onishoji or like a dog. I don't know if you understand. I keep saying it before. You will see people, anytime somebody wants to treat malaria or treat typhoid, and most of these antibiotics, they have additive. They have so many things apart from the active ingredient. And these things has to be worked on by the kidney.